I think there are a lot of unanswered questions in lung cancer.
There are lots of key unanswered questions in lung cancer at the moment.
To me, the key unanswered question at the moment in lung cancer is which immunotherapy we should give to which patient at what time and in which combination.
Scanning the horizon and thinking about some of the key unanswered questions in lung cancer, as in many other diseases, we need to know how best to use the checkpoint inhibitors. I guess for the first time, certainly in lung cancer, with patients with advanced stage disease, we're talking about long-term disease control in a minority. So that's a spectacular thing to be even considering.
I think there are a lot of unanswered questions in lung cancer. I think some of them we have the answer to. For example, lung cancer screening does reduce mortality, but how can we afford it is a question. I think for those of us who are not in the diagnosing end of the pathway, but in the treating end of the pathway, I think it's what is the best way to schedule all the new techniques we have. So we have a lot of high-end technical radiotherapy, we've got a lot of new drugs, a lot of new types of drugs. How do we deliver those together to get the best outcomes for our patients, I think is the biggest unanswered question.
The unmet needs in cancer now, in lung cancer, have actually changed to be the same as unmet needs in every other cancer, because we've got effective therapies. And so obviously the key unmet need is the fact that all these patients ultimately develop resistant disease, and most of them will, and they will die from the disease at some stage. So we just got to keep improving the treatments we give to patients, and the only way we can do that is by having meetings, by working together.
I think we need to work out what the best way is to detect lung cancer early in a population. And we've got this fantastic data from the United States suggesting low-dose CT it provides mortality benefit in 55 to 74-year-olds who have annual CT for 3 years. But how do we translate that into clinical care, not just in the UK and Europe, but across the world? And are we sufficiently resourced outside North America to deliver these benefits?
For me, as somebody working in the audit, it's critical that we try and bring the standard of care delivered by all organisations up to that of the best performing ones.
I think the key unanswered question in lung cancer is, are we really hoping that by combining the immunotherapy compounds, by personalizing, meaning that we need to define biomarkers, we will reach a point where we can cure a larger cure or have a very long-term control, more than 5 years, right, by definition, of non-small cell lung cancer.
There are lots of key unanswered questions in lung cancer at the moment, such as questions about biology and which tumours respond to which treatment. That's all ongoing. It's an exciting field. But for me, with my specialty interest, one of the key questions that we need to answer at the moment is, should we implement CT screening for lung cancer or not?